Today, we're digging into a really fascinating cosmetic procedure, one that's trying to completely change the game for how we treat the area around our eyes. It's called the G-point lift, and believe me, it's a whole new way of thinking. So let's get right into it. But let's start with a question you've probably asked yourself looking in the mirror. I know I have. Why is that area right under our eyes so stubborn, so hard to fix? It's like it's the first place to betray a bad night's sleep, stress, or, just life itself. And you know what? There's a really specific reason for that. This isn't just some vague under-eye problem. Nope. Experts have actually pinpointed the exact spot where those first signs of aging really love to show up. They call it the eyelid-cheek junction. It's that little zone, that transition from the soft skin of your lower eyelid down to your cheek. And the anatomy there is super complex. You've got ligaments anchoring everything to the bone, which makes it a uniquely tricky area to work with. This is ground zero for all those issues we know so well. We're talking about dark circles, which, let's be real, can show up even when we're young, those dreaded under-eye bags, a bit of sag or skin laxity, and that general loss of volume that just creates shadows where we don't want them. So for years, if you wanted to do something about it, you were stuck between a rock and a hard place. The choices were, well, they were at total opposite ends of the spectrum. And honestly, neither one was a perfect solution. The two traditional paths were just so different. You had surgery, a blepharoplasty. Yeah, it works, and the results last a long time, but it's also a major procedure. It's expensive, and the recovery time is no joke. Then on the other side, you've got traditional fillers. They're non-invasive, sure, but the results? Kind of limited, and they don't last very long. Plus, they come with their own set of potential problems, and you often need a lot of product. It was a classic pick-your-poison situation. And this exact dilemma is what forced people to think outside the box. I mean, the gap between a massive surgery and a temporary, sometimes iffy fix was just huge. There had to be something that could bridge that gap. And that leads us straight to this breakthrough. An oculoplastic surgeon, Dr. Francesco Bernardini, came up with a new technique. And the brilliant part is, he didn't invent some new magic potion, he just pioneered a totally new way of looking at the anatomy. He calls it the G-point lift. And here's the kicker. It uses a regular hyaluronic acid filler, something that's been around for ages. The real magic is how and where it's put. By injecting it into one single strategic spot, the G-point, the entire goal changes. You're not just filling a hole, you are physically lifting the tissue. The ambition here is massive. We're talking about getting a result that looks like you had surgery, but without the surgery. That's a bold claim, right? So how on earth does it work? It works because the whole idea behind it is a complete 180 from how fillers have been used in the past. It's about changing the mission entirely, from just filling in empty spaces to actually creating structural lift. Dr. Bernardini himself has the perfect way to say it. In Italian, it's non riempire, ma sollevare, which means simply not fill, but lift. That one little phrase, that's the entire revolution in a nutshell. And that's what's so incredibly clever about it. Instead of just plumping up the skin, the filler is used like a building material. It's like thinking like a surgeon, finding the anchor points, the places that need support, but using a non-invasive tool to do it, the needle. The technique itself is this really elegant two-step dance. First, you have the lift. A thick structural filler, one with what's called a high G prime, is injected deep down at that G point. It acts like a tiny invisible pillar, literally propping up and lifting the whole eyelid cheek area. Then you have the finish. A much softer, more delicate filler is used just to blend and smooth out that transition, giving what the doctor calls a Photoshop effect. Now, you can't just use any old filler for this. It's a highly specialized job that needs the right tools. For that heavy lifting part, you need a high G prime filler like Ultra Deep or RHA4. But for that delicate finishing touch, you go with something like Red and C2 because it's one of the only ones specifically designed for that super sensitive under eye skin. So the million-dollar question, does it actually deliver? Can you really get results that look surgical without actually going under the knife? All right, let's look at the stats. First up, time. The whole thing is done in about 30 minutes. Seriously, that's faster than a lot of lunch breaks. Okay, what about recovery, pain, downtime? Zero. None. Patients can literally get up and go right back to their day with almost no risk of bruising. Just think about that compared to the weeks of hiding out after surgery. The difference is just staggering. And how long does it last? The results stick around for at least a year, and a lot of times even longer. That's way better than traditional filler techniques, where you're often heading back for touch-ups every few months. Now, of course, the cost. It's not cheap. It starts at around €1,000, give or take, depending on how much product you need. But even though that's a real investment, it's still way, way less than what you'd pay for a full surgical procedure. So let's just sum it all up. The advantage here is pretty clear, right? You get a real surgical style lift. It's non-invasive, you have basically immediate recovery, the results last for over a year, and the risk of side effects is super low. It pretty much checks all the boxes that the old options left empty. Which leaves us with one last really big question. As techniques like the G-point lift get even better and more doctors start doing them, are we watching the beginning of the end for the old-school invasive eye lift surgery? You know, only time will tell, but it's a huge shift in what we thought was possible.